Hey guys, I'm coming to you to bring you the new SMDO newborn hypoglycemia protocol. Some of you I've already in-serviced. This actually has been updated, so just make sure at the bottom you have the most updated version if you decided to take a copy of it or you wanted one for your personal records. So just make sure it's August 2019. So the only few things that had changed was a recommendation of doing birth weight in grams versus kilograms. So that's one of the big ones on there. Other than that, so the way this works, same way as it always has. So instead of having two sheets, we just have one sheet. There's 0 to 4 hours and 4 to 48 on the same sheet with different parameters to follow based on how many hours old your baby is. So if you're in the red at 0 to 4 or from 4 to 48, so less than 25 or less than 35, you'll just follow the same algorithm, and then it does tell you to give the oral glucose gel. I'll show you what that is and how that looks in a minute. And then it also says consider to transfer to NICU at this point. At any point, if you're in yellow, obviously notify provider stat to consider transfer to NICU for another portion. After greater than 4 doses and 24 hours of glucose gel, the baby will be a NICU admission. So definitely look at what the order set also looks like so you're aware. Sorry, I'm doing it all by myself today. So it's not as perfect as it normally is. Same parameters, last 3 pre-feed glucose is greater than 45, and then your 24 and 48 hour checks also. I created new little badge cards, so I will give these out. I'll actually put them on the time card on the 27th, so make sure you throw away your old ones. They're relatively the same, they just talk a little bit about glucose gel somewhere in it. If I can remember, I created these quite a while ago. So along with this glucose gel, I'll show you how to administer it. And in the Omnicell, we will have 6 tubes of this on mother baby and 2 tubes of this on labor and delivery. If we need more tubes, let me know and I can get the PAR increased with pharmacy. We just need to have that communication. So if we were definitely not having enough, let me know. These tubes, so this is what it looks like. It comes in 2 flavors, grape and lemon. I'm pretty sure here we only have the grape flavor. So it's a huge tube. We don't use that much of it, but it's a one-time use. So once you use what you need to use for your baby, you put it in the trash and you get a new tube for the next time that you need it. It's just so it has no, we don't know what kind of bacteria grows in it. So this has usually a twist top right here on it. You just twist it off, take a medicine cup, squirt some in the medicine cup. So based on how much your baby weighs will be based on what you're going to give. So obviously you would have gloves on. I do not have gloves on right now because I'm, doing this multiple tasking here. So you want to take a piece of 4x4 gauze and go in the baby's mouth and dry out the sides of the mouth. So this is a buccal administration. So we want to make sure we get it on the sides of the cheek and we massage it really well. The goal is the more massage you do to massage in the medicine, the better it works. So once you just squirted a whole bunch into your medicine cup, you pull out exactly what you need. So based on the kilograms, we'll just say we have a 4 kilo baby, because that'll be easy, for 2 mLs. It's very thick and it's going to have a lot of bubbles in it, so just make sure you do the best you can with getting as much glucose gel and getting the air out. So see all that air. So after you get what you're going to administer, so you're going to administer, if we're doing 2 mLs, you're going to do 1 ml in one side of the mouth and 1 ml on the other side of the mouth. We're going to try this in 0.5 increments. You guys being at the bedside are going to know what works best and how this is going to work the best way for you guys. So you're going to put some on your gloved finger. You're going to put your finger inside the baby's mouth and massage it onto that side of the cheek. And then you're going to do some more, and then you're going to do the other side of the cheek. So let's just say we did 0.5 there, so we're doing another 0.5 here. That's 1 ml, and then we're going to do it again to finish it off. Another half, massage it into this side of the cheek, another half, and then massage it into the other side. At that point, depending on where we're at, so if we gave gel, we're going to directly breastfeed, and we're going to supplement. So we're not going to skip supplementation. So we can feed with EBM, donor breast milk we don't have yet, but we plan on getting, and/or formula, and then we'll repeat the blood sugar in 30 minutes after the feeding of the gel. and then we'll see where we're at and kind of just continue following the algorithm. If you guys have any questions about this, please feel free to contact me and ask questions. It's quite a bit of different new information, same algorithm, just different look. Also, SMDO late preterm is coming out at the same time. What this means is all these babies are going to need yellow hats on their heads. We have a bunch of knitted hats already, so we just need to figure out a process. If you guys have any ideas on how to make sure these babies don't fall through the cracks, let me know. We have a crib card. I've put some in the drawer where the pink and blue name cards are over on the labor side, and I put some on mother baby side, and they created a file folder for them. And they're a late preterm card. And then they're definitely going to have an increased amount of vital signs initially, and there's also a parent handout flyer. It's also on my education board. Please don't forget to sign my education board and just say that you've acknowledged and read the information on it. And there's a flyer. There currently are flyers on the mother baby side in the filing cabinet. The labor side I'm trying to work on and trying to figure out where the best place those would be kept is. So if you guys have any ideas,